Welcome to my channel. When a doctor is consulted for pregnancy, the doctor often prescribes various medication and injection for conception. Among them, hCG injection is one of them. Many sisters have asked me about hCG injection. So, in this video, I will discuss about what is an hCG injection, how does hCG injection help in conception, and when an hCG injection administered, where and how is the hCG injection given, and what are the important things to note after administering the hCG injection for conception. So let's get started. Number 1. What is an hCG injection? The full form of hCG is the human chorionic gonadotropin hormone. So hCG is essentially a type of hormone. When a woman conceives, this hormone is first present in her body. So, to confirm pregnancy, we often rely on urine test, primarily detecting the presence of hCG hormone in the urine. This injection is given to both men and women as a treatment for infertility. Now, you may be wondering that if the hormone is found in the pregnant mother's body, why is the hormone again given for conceiving pregnancy? I will explain that, so please stay patient and watch. We have a part of our brain called the anterior pituitary gland. From this anterior pituitary gland, a hormone is released called GnRH or gonadotropin releasing hormone. These hormones play a crucial role in the development of reproductive organ in both women and men and regulate the other hormone in the reproductive system. Gonadotropin releasing hormone then releases two more hormones, namely FSH or follicle stimulating hormone and LH or luteinizing hormone. Now let's see how these two hormones contribute to the growth of a woman's ovarian follicles and the process of ovulation. Look at this diagram. This is an image of the female ovaries. In the ovaries, there are numerous small dormant eggs called primordial follicles. What is follicle? A follicle is like a water sac that contains an egg from potential fertilization. Every month, starting from the beginning of the menstrual cycle, some primordial follicle begins to grow larger. These are then called primary follicles. FSH or follicle stimulating hormone stimulates the primary follicle, causing the follicle to grow even larger, and they are called secondary follicles. These secondary follicles increase the production of estrogen hormone in the woman's body. At this time, luteinizing hormone has been released. Luteinizing hormone then stimulates the secondary follicles, leading to ovulation. After ovulation, the egg surrounding structure is left behind the ovary, and it is called corpus luteum. This corpus luteum releases a hormone called progesterone in the woman's body. This is because during ovulation, if fertilization occurs, the eggs unite with the male sperm, resulting in the formation of an embryo. Progesterone plays a crucial role in preparing the uterine wall for implantation. Therefore, progesterone helps in pregnancy. Along with this, luteinizing hormone maintains the corpus luteum for secretion of progesterone to implant the embryo in the uterine wall and helps to maintain the pregnancy. Now let's discuss when is an hCG injection administered. The administration of hCG injection is crucial for inducing luteinizing hormone in the body, which is necessary for ovulation. To determine the appropriate timing for hCG injection, it is essential to monitor the growth of a follicle. For ovulation, a follicle needs to reach a size of 18 mm or larger. When a follicle reaches 18 mm, it is considered mature. Doctor conduct a specific examination called follicular study or folliculometry at a designated time during the menstrual cycle to observe the size and growth of the follicle. When it is observed that the size of the follicle is 18 mm or more, typically after a specific number of days following the menstrual period, the hCG injection is administered. In summary, an hCG injection is given after follicular study reveals that the follicular has reached a size of 18 mm or large, and it is usually administered a specific number of days after the onset of menstrual period. It is important to note that hCG injections should not be given based on menstrual cycle. It should be given according to the result of follicular study. How does hCG injection help in conception? By now, we understand that for women to undergo ovulation, luteinizing hormone is necessary and progesterone hormone is needed for conception. Generally, the molecular structure of luteinizing hormone and human chorionic gonadotropin hormones is almost same. Consequently, if someone has low level of luteinizing hormone, or if we want to induce ovulation as needed, an hCG injection is administered to increase the luteinizing hormone level. Around 36 to 48 hours after the hCG injection, ovulation occurs in women. During ovulation, if fertilization takes place, the chance of conception are significantly increased. Therefore, hCG injection helps induce ovulation in women and it sustains the corpus luteum, ensuring the increase in progesterone level in the body. As a result, the likelihood of conception is greatly enhanced. For men with low sperm count and low testosterone level, they are often given hCG injection. Now let's understand where and how is an hCG injection administered. An hCG injection is typically administered in the muscular tissue of the arm and thigh, and it can be also given subcutaneously. The dose of hCG injection is available in two strengths, 5000 international unit and 10,000 international unit. As of now, the cost of 5000 international unit is around 2300 Bangladeshi taka, while the cost of 10,000 international unit is approximately 4000 Bangladeshi taka. The choice between 5000 international unit and 10,000 international unit depend on the result of your follicular study, which your doctor will conduct to determine the most suitable option for you. Your doctor will recommend either 5000 or 10,000 international unit of hCG injection, and you should administer the prescribed dose. Therefore, it is crucial to follow doctor's guidelines and take hCG injection only under their recommendation. After administering an hCG injection for conception, it is crucial to keep in mind the following consideration. Number 1. Ovulation typically occurs 36 to 48 hours after the hCG injection. Therefore, it is essential to engage in intercourse at a one-day intervals or daily from 1 day before the schedule of injection until 4 to 5 days afterwards. This is because this time frame encompasses the period of ovulation, and intercourse during this time maximum chance of conception. Number 2. The effects of the injection may persist for 6 to 7 days in the body. Therefore, it is recommended to wait at least 15 days after the injection before taking a pregnancy test. If you suspect that you might be pregnant, it is advised to not take the hCG injection at any time. Number 4. Additionally, if you have a condition such as polycystic ovarian syndrome, asthma, hypertension, migraine, cancer, thyroid problem, hormonal imbalance, heart disease, kidney disease, or any other health concern, it is crucial to inform your doctor before taking this injection. Otherwise, it may be dangerous for you. Now let's discuss the side effect of hCG injection. Every medicine has some side effect, but not everyone will have them. There may be some reaction after taking hCG injection, but not everyone will experience the side effect. Common side effects including nausea, vomiting, headache, mild abdominal discomfort, breast tenderness, or mood swing. These are generally minor side effects and resolve within a few days without any kind of medical treatment. Therefore, after taking an hCG injection, there are a potential complication known as ovarian hyperstimulation syndrome or OHSS. Recognize the symptom of OHSS is important. Ovarian hyperstimulation syndrome symptoms like rapid weight gain, fluid accumulation in the abdomen, abdominal discomfort, difficulty in breathing, retention of urine. If you experience any of this symptom, it is crucial to seek promote medical attention. Ovarian hyperstimulating syndrome can be a serious condition and delayed treatment may be lead to life-threatening complication. Therefore, before taking such injection, it is essential to consult your infertility specialist who can assess your individual health status, provide personalized guideline and monitoring your response of the treatment to minimize the risks of complication. Will pregnancy occur after taking an hCG injection? The answer is no. Taking an hCG injection or human chorionic gonadotropin injection does not guarantee the pregnancy. It is merely one step of infertility treatment. In addition to being a part of infertility treatment, hCG injections are often administered as a step-in procedure like IUI or intrauterine insemination and IVF in vitro fertilization. So I hope we understand. Hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.